Question 1. A 64-year-old male arrives in the emergency department complaining of crushing substernal chest pain radiating to the left arm and jaw for the past 45 minutes. He appears pale, diaphoretic, and anxious. Vital signs are BP 8860 mm Hg, HR 118 minutes, RR 26 minutes, and SpO2 91% on room air. The 12-lead ECG shows ST segment elevation in leads 2, 3, and AVF. Troponin levels are elevated. The healthcare provider prescribes oxygen at 2 liters per minute via nasal cannula, aspirin 325 mg PO, nitroglycerin sublingual every 5 minutes times 3 doses PRN chest pain, and IV morphine PRN. Which nursing action is the priority before administering nitroglycerin? A. Administer morphine first to decrease preload. B. Assess blood pressure and evaluate for right ventricular infarction. C. Place the client in Trendelenburg position. D. Encourage deep breathing exercises before medication administration. Answer. B. Assess blood pressure and evaluate for right ventricular infarction. Rationale. Inferior wall myocardial infarctions involving leads 2, 3, and AVF can extend to the right ventricle. Nitroglycerin decreases preload and may cause profound hypotension in right ventricular infarction. The client is already hypotensive, making assessment of hemodynamic stability the priority before nitroglycerin administration. Question 2. A nurse is caring for a client 8 hours after undergoing percutaneous coronary intervention with stent placement following an anterior wall myocardial infarction. The client suddenly reports severe chest pain rated 9 out of 10, becomes restless, and develops new ST segment elevations on the cardiac monitor. Which complication should the nurse suspect first? A. Dressler syndrome. B. Acute stent thrombosis causing reocclusion. C. Pulmonary embolism. D. Ventricular remodeling. Answer. B. Acute stent thrombosis causing reocclusion. Rationale. Acute stent thrombosis is a life-threatening complication characterized by abrupt vessel occlusion after PCI. Sudden recurrent chest pain with new ST segment elevation strongly suggests reinfarction due to thrombosis within the stent. Question 3. A client with acute myocardial infarction suddenly develops shortness of breath, pink frothy sputum, diffuse crackles throughout both lung fields, and oxygen saturation of 82% despite oxygen via nasal cannula. Which nursing intervention is the highest priority? Encourage oral fluid intake to improve cardiac output. B. Prepare for immediate administration of IV diuretics and ventilatory support. C. Place the client flat to improve coronary perfusion. D. Obtain a sputum specimen before further intervention. B. Prepare for immediate administration of IV diuretics and ventilatory support. Rationale. The client is experiencing acute pulmonary edema secondary to left ventricular failure after myocardial infarction. Immediate interventions focus on reducing preload, improving oxygenation, and preventing respiratory failure. Question 4. A nurse is monitoring a client admitted with non-ST elevation myocardial infarction, NSTEMI. The client suddenly becomes unresponsive and pulseless. The cardiac monitor displays ventricular fibrillation. Which action should the nurse perform first? Answer. B. Begin chest compressions and prepare for immediate defibrillation. Rationale. Ventricular fibrillation is a lethal rhythm requiring immediate CPR and defibrillation. Early defibrillation is the most critical intervention for survival. Question 5. A client recovering from an acute myocardial infarction asks the nurse why beta blockers are prescribed after the event. Which response by the nurse is most accurate? A. These medications dissolve coronary artery clots. B. They increase myocardial contractility to improve perfusion. C. They reduce heart rate and myocardial oxygen demand. D. They prevent all future dysrhythmias from occurring. Answer. C. They reduce heart rate and myocardial oxygen demand. Rationale. Beta blockers reduce sympathetic stimulation, lowering heart rate, blood pressure, and myocardial oxygen consumption, thereby decreasing cardiac workload and reducing mortality after MI. Question 6. A client 3 days after a large anterior myocardial infarction becomes acutely dyspneic and hypotensive. Assessment reveals a new loud systolic murmur at the apex and signs of pulmonary edema. Which complication should the nurse suspect? A. Papillary muscle rupture causing acute mitral regurgitation. B. Ventricular aneurysm formation. C. Dressler syndrome. D. Stable angina pectoris. Answer. A. Papillary muscle rupture causing acute mitral regurgitation. Rationale. Papillary muscle rupture is a catastrophic mechanical complication after MI that causes acute mitral regurgitation, pulmonary edema, hypotension, and a new systolic murmur. Question 7. A nurse is caring for a client receiving continuous IV nitroglycerin after an acute myocardial infarction. Which finding requires immediate intervention? A. Mild headache rated 2/10. B. Blood pressure decrease from 146/88 mm Hg to 132/80 mm Hg. C. Heart rate increase from 82 minutes to 88 minutes. D. Blood pressure of 78/48 mm Hg with dizziness. Answer. D. Blood pressure of 78/48 mm Hg with dizziness. Rationale. Severe hypotension is a dangerous adverse effect of nitroglycerin and may significantly reduce coronary perfusion, worsening myocardial ischemia. Question 8. A client admitted for myocardial infarction develops frequent premature ventricular contractions, PVCs, including runs of ventricular tachycardia. Laboratory studies reveal potassium 2.9 MEq per liter and magnesium 1.3 mg per deciliter. A. Restrict potassium-containing foods. B. Administer prescribed electrolyte replacement promptly. C. Place the client in Trendelenburg position. D. Encourage ambulation to improve circulation. Answer. B. Administer prescribed electrolyte replacement promptly. Rationale. Hypokalemia and hypomagnesemia significantly increase the risk for lethal ventricular dysrhythmias after myocardial infarction. Question 9. A client with acute myocardial infarction states, "I feel like I'm going to die." Which nursing response is most therapeutic? A. You should try to stay calm because stress worsens heart attacks. B. Everything will be fine, so don't worry. C. Tell me more about what you are feeling right now. D. Many clients feel this way during hospitalization. Answer. Tell me more about what you are feeling right now. Rationale. Open-ended therapeutic communication encourages emotional expression and allows the nurse to assess anxiety, fear, and psychological distress during a critical event. Question 10. A nurse is preparing to administer thrombolytic therapy to a client experiencing an ST elevation myocardial infarction. Which assessment finding is the greatest contraindication to thrombolytic administration? A. Blood pressure 150/92 mm Hg. B. History of ischemic stroke 6 years ago. C. Active internal bleeding from a peptic ulcer. D. Age greater than 70 years. Answer. C. Active internal bleeding from a peptic ulcer. Rationale. Active bleeding is an absolute contraindication to thrombolytic therapy because fibrinolytics significantly increase hemorrhage risk. Question 11. A nurse is caring for a client 24 hours after admission for an acute ST elevation myocardial infarction involving the left anterior descending artery. The client suddenly develops confusion, cool clammy skin, oliguria, BP 76 over 40 millimeters of mercury, heart rate 132 per minute, and weak peripheral pulses. Hemodynamic monitoring reveals a cardiac index of 1.7 liters per minute per square meter. Which complication should the nurse recognize first? A. Hypovolemic shock. B. Cardiogenic shock. C. Neurogenic shock. D. Septic shock. Answer. B. Cardiogenic shock. Rationale. Cardiogenic shock occurs when extensive myocardial damage severely impairs cardiac output. Hypotension, poor tissue perfusion, oliguria, altered mental status, and low cardiac index are classic findings after a major MI. Question 12. A client with myocardial infarction is receiving IV heparin therapy. Which assessment finding should the nurse report immediately to the healthcare provider? A. Activated partial thromboplastin time APTT 62 seconds. B. Small ecchymosis at the IV insertion site. C. Sudden severe flank pain and hematuria. D. Platelet count of 180,000 per cubic millimeter. Answer. C. Sudden severe flank pain and hematuria. Rationale. Flank pain with hematuria may indicate serious internal bleeding associated with anticoagulant therapy and requires immediate intervention. Question 13. A nurse is assessing a client recovering from myocardial infarction who suddenly develops jugular venous distension, muffled heart sounds, hypotension, and pulsus paradoxus. Which complication should the nurse suspect? A. Cardiac tamponade. B. Pulmonary embolism. C. Ventricular aneurysm. D. Chronic heart failure. Answer. A. Cardiac tamponade. Rationale. The triad of hypertension, muffled heart sounds, and jugular venous distension indicates cardiac tamponade. This may occur after myocardial wall rupture and is a medical emergency. Question 14. A client with acute myocardial infarction asks why serial troponin levels are being measured. Which response by the nurse is most appropriate? Answer. Troponin helps identify and evaluate the extent of heart muscle injury. Rationale. Troponin is a highly specific biomarker released during myocardial injury. Serial measurements help confirm diagnosis and assess infarction progression. Question 15. A nurse is caring for a client who had a myocardial infarction 4 days ago. The client suddenly reports tearing chest pain, radiating to the back, becomes hypotensive, and loses consciousness. Which complication should the nurse suspect? A. Ventricular septal rupture. B. Left ventricular free wall rupture. C. Pericarditis. D. Stable angina. Answer. B. Left ventricular free wall rupture. Rationale. Free wall rupture is a catastrophic complication occurring several days after MI. It often causes cardiac tamponade, profound hypotension, and sudden death. Question 16. A client with myocardial infarction is prescribed morphine sulfate for chest pain unrelieved by nitroglycerin. Which assessment finding indicates the medication has been effective? A. Respiratory rate decreases from 24 per minute to 20 per minute, and chest pain decreases. B. Heart rate increases from 84 per minute to 110 per minute. C. Blood pressure rises from 100 over 60 mm Hg to 158 over 94 mm Hg. D. Oxygen saturation decreases from 96% to 90%. Answer. Respiratory rate decreases from 24 per minute to 20 per minute, and chest pain decreases. Rationale. Morphine decreases anxiety, preload, and pain, thereby reducing myocardial oxygen demand. Improved comfort and stabilization of respiratory distress indicate therapeutic effectiveness. Question 17. A nurse is evaluating telemetry strips for a client admitted with acute myocardial infarction. Which rhythm requires immediate intervention? A. Sinus bradycardia at 56 minute. B. Occasional premature atrial contractions. C. Sustained ventricular tachycardia with hypotension. D. First-degree atrioventricular block. Answer. C. Sustained ventricular tachycardia with hypotension. Rationale. Sustained ventricular tachycardia can rapidly deteriorate into ventricular fibrillation and severely compromise cardiac output, especially when associated with hypotension. Question 18. A client recovering from myocardial infarction asks the nurse when sexual activity can be resumed safely. Which response is most appropriate? A. Sexual activity should never be resumed after a heart attack. B. You may resume sexual activity when you can tolerate moderate physical activity without symptoms. C. Wait at least 1 year before resuming sexual activity. D. Only the healthcare provider can discuss this topic. Answer. B. You may resume sexual activity when you can tolerate moderate physical activity without symptoms. Rationale. Sexual activity may generally resume once the client can tolerate moderate exertion, such as climbing stairs, without chest pain or dyspnea. Question 19. A nurse is caring for a client with myocardial infarction receiving alteplase therapy. Which assessment finding requires the most immediate action? A. Mild oozing at the IV site. B. Complaint of nausea. C. Sudden severe headache and decreased level of consciousness. D. Heart rate of 92 per minute. Answer. C. Sudden severe headache and decreased level of consciousness. Rationale. Neurological changes during thrombolytic therapy may indicate intracranial hemorrhage, a life-threatening complication requiring immediate intervention. Question 20. A client with myocardial infarction develops increasing shortness of breath and bibasilar crackles. Pulmonary artery wedge pressure is elevated. Which nursing interpretation is most accurate? A. The client is experiencing worsening left ventricular failure. B. The client is adequately hydrated. Right ventricular function has improved. D. Cardiac output has normalized. Answer. A. The client is experiencing worsening left ventricular failure. Rationale. Elevated pulmonary artery wedge pressure and crackles indicate pulmonary congestion due to left ventricular dysfunction after myocardial infarction. Question 21. A nurse is caring for a client admitted with an acute inferior wall myocardial infarction. The client suddenly develops bradycardia with a heart rate of 38 per minute, hypotension, dizziness, and altered mental status. Which prescribed intervention should the nurse implement first? A. Administer IV atropine. B. Prepare the client for stress testing. C. Encourage coughing and deep breathing. D. Place the client in high Fowler's position only. Answer. A. Administer IV atropine. Rationale. Symptomatic bradycardia after inferior wall MI commonly results from increased vagal stimulation or AV nodal ischemia. Atropine is the first-line medication to increase heart rate and improve perfusion. Question 22. A client with myocardial infarction is receiving dual antiplatelet therapy with aspirin and clopidogrel following coronary stent placement. Which statement by the client indicates understanding of discharge teaching? A. I can stop taking clopidogrel once I no longer have chest pain. B. I should notify my healthcare provider if I notice unusual bleeding. C. This medication combination completely prevents another heart attack. D. I should avoid taking aspirin because it increases clot formation. Answer. B. I should notify my healthcare provider if I notice unusual bleeding. Rationale. Dual antiplatelet therapy increases bleeding risk. Clients should report signs such as bruising, black stools, bleeding gums, or hematuria promptly. Question 23. A nurse is monitoring a client 48 hours after myocardial infarction. The client suddenly develops a fever, pleuritic chest pain, and a pericardial friction rub. Which condition should the nurse suspect? A. Dressler syndrome. B. Pulmonary edema. C. Ventricular septal rupture. D. Cardiogenic shock. Answer. A. Dressler syndrome. Rationale. Dressler syndrome is post-myocardial infarction pericarditis caused by an inflammatory autoimmune response. Findings include fever, pleuritic chest pain, and a friction rub. Question 24. A client with acute myocardial infarction becomes increasingly restless and anxious. Oxygen saturation drops from 96% to 88%, and crackles are auscultated bilaterally. Which action should the nurse take first? A. Increase oxygen delivery and reassess respiratory status. B. Encourage ambulation to mobilize secretions. C. Limit fluid intake immediately. D. Administer a sedative before further assessment. Answer. A. Increase oxygen delivery and reassess respiratory status. Rationale. Hypoxemia and pulmonary congestion indicate worsening cardiac function. Immediate improvement of oxygenation is the priority to prevent respiratory compromise. Question 25. A nurse is educating a client recovering from myocardial infarction about smoking cessation. Which statement by the client requires further teaching? A. Smoking causes coronary artery constriction. B. Quitting smoking can reduce my risk of another heart attack. C. Using nicotine while smoking cigarettes can increase cardiac risk. D. Smoking mainly affects the lungs and has little effect on the heart. Answer. D. Smoking mainly affects the lungs and has little effect on the heart. Rationale. Smoking significantly contributes to coronary artery disease, vasoconstriction, thrombosis, and myocardial infarction risk. Question 26. A client with an acute anterior myocardial infarction develops sudden hypotension and a new harsh systolic murmur heard along the left sternal border. Which complication should the nurse suspect? A. Papillary muscle rupture. B. Ventricular septal rupture. C. Pericarditis. D. Aortic dissection. Answer. B. Ventricular septal rupture. Rationale. A new harsh systolic murmur with rapid hemodynamic deterioration after MI suggests ventricular septal rupture, a mechanical complication causing left-to-right shunting and cardiogenic shock. Question 27. A nurse is caring for a client with myocardial infarction who suddenly develops frequent multifocal premature ventricular contractions, progressing into torsades de pointes. Which medication should the nurse anticipate administering? A. Magnesium sulfate. B. Calcium gluconate. C. Sodium bicarbonate. D. Dopamine. Answer. A. Magnesium sulfate. Rationale. Torsades de pointes is commonly associated with prolonged QT interval and magnesium deficiency. IV magnesium sulfate is the treatment of choice. Question 28. A client recovering from myocardial infarction states, "I feel exhausted after even minor activity." Which nursing response is most appropriate? Complete bed rest is necessary for several months. B. Fatigue is common after myocardial infarction, and activity should gradually increase as tolerated. C. You should avoid all physical activity permanently. D. Exhaustion means another heart attack is occurring. Answer. B. Fatigue is common after myocardial infarction, and activity should gradually increase as tolerated. Rationale. Fatigue commonly occurs during recovery due to decreased cardiac reserve and healing. Gradual progressive activity is encouraged. Question 29. A nurse is caring for a client with myocardial infarction receiving IV dopamine for cardiogenic shock. Which assessment finding best indicates the medication is effective? A. Urine output increases from 15 milliliters per hour to 40 milliliters per hour. B. Respiratory rate increases from 18 minutes per minute to 30 minutes per minute. C. Pulmonary crackles become more pronounced. D. Heart rate increases from 90 minutes per minute to 138 minutes per minute. Answer. A. Urine output increases from 15 milliliters per hour to 40 milliliters per hour. Rationale. Improved urine output indicates enhanced renal perfusion and improved cardiac output, showing effectiveness of dopamine therapy. Question 30. A client hospitalized for myocardial infarction suddenly develops severe chest pain, unrelieved by nitroglycerin, ST segment elevation, diaphoresis, and nausea. Which nursing action is the highest priority? A. Obtain a focused pain history after 30 minutes. B. Notify the rapid response team or healthcare provider immediately. C. Encourage relaxation techniques before additional interventions. D. Administer scheduled oral medications first. Answer. B. Notify the rapid response team or healthcare provider immediately. Rationale. Persistent severe ischemic chest pain with ST elevation suggests ongoing myocardial injury or reinfarction requiring immediate intervention to restore coronary perfusion. Question 31. A nurse is caring for a client 12 hours after a myocardial infarction who suddenly develops cool extremities, worsening dyspnea, confusion, and oxygen saturation of 84% despite supplemental oxygen. The client's blood pressure is 82/50 millimeters of mercury, and auscultation reveals diffuse crackles throughout the lungs. Which intervention should the nurse prioritize? A. Administer prescribed vasopressors and prepare for advanced hemodynamic support. B. Encourage oral fluids to improve preload. Place the client in Trendelenburg position. D. Ambulate the client to improve circulation. A. Administer prescribed vasopressors and prepare for advanced hemodynamic support. Rationale. The client is exhibiting signs of cardiogenic shock with pulmonary edema. Immediate interventions focus on maintaining perfusion, supporting cardiac output, and improving oxygenation. Question 32. A client recovering from myocardial infarction asks the nurse why an ACE inhibitor was prescribed. Which response by the nurse is most accurate? This medication dissolves clots in the coronary arteries. It helps prevent ventricular remodeling and reduces cardiac workload. C. It directly increases heart rate to improve circulation. The medication eliminates all dysrhythmias after myocardial infarction. Answer. It helps prevent ventricular remodeling and reduces cardiac workload. Rationale. ACE inhibitors reduce afterload and help prevent ventricular remodeling after myocardial infarction, improving long-term cardiac outcomes. Question 33. A nurse is caring for a client who develops chest pain 5 days after a myocardial infarction. The pain worsens with inspiration and decreases when the client leans forward. A pericardial friction rub is auscultated. Which complication should the nurse suspect? A. Stable angina. B. Acute pericarditis. C. Pulmonary embolism. D. Aortic stenosis. Answer. B. Acute pericarditis. Rationale. Pericarditis after MI presents with pleuritic chest pain relieved by leaning forward and a characteristic friction rub. Question 34. A client with myocardial infarction suddenly develops pulseless electrical activity PEA. Which nursing action is the priority? A. Immediate initiation of high-quality CPR. B. Administer oral aspirin. C. Prepare the client for ambulation. D. Obtain a 12-lead ECG before interventions. Answer. A. Immediate initiation of high-quality CPR. Rationale. PEA is a non-perfusing rhythm requiring immediate CPR and identification of reversible causes according to advanced cardiac life support guidelines. Question 35. A nurse is caring for a client receiving IV nitroglycerin after myocardial infarction. Which finding indicates the medication is achieving the desired therapeutic effect? A. Chest pain decreases from 8 out of 10 to 2 out of 10. B. Heart rate increases from 78-minute to 126-minute. C. Oxygen saturation decreases from 96% to 88%. D. Blood pressure falls from 132/84 mm Hg to 70/40 mm Hg. Answer. A. Chest pain decreases from 8 out of 10 to 2 out of 10. Rationale. Nitroglycerin reduces myocardial oxygen demand and improves coronary perfusion, leading to relief of ischemic chest pain. Question 36. A client 2 days after myocardial infarction develops sudden severe shortness of breath and pink frothy sputum. Which assessment finding would the nurse expect? A. Clear lung sounds bilaterally. B. Bradycardia with warm dry skin. C. Diffuse pulmonary crackles and hypoxemia. D. Decreased respiratory effort with hyperactivity. Answer. C. Diffuse pulmonary crackles and hypoxemia. Rationale. Pink frothy sputum indicates acute pulmonary edema resulting from left ventricular failure, commonly accompanied by crackles and severe hypoxemia. Question 37. A nurse is teaching a client recovering from myocardial infarction about dietary modifications. Which statement by the client indicates understanding of the teaching? A. I should limit saturated fats and reduce sodium intake. B. I can eat unlimited processed foods if I avoid sugar. C. High sodium foods improve circulation after heart attacks. D. Diet changes are unnecessary once medications are prescribed. Answer. I should limit saturated fats and reduce sodium intake. Rationale. Reducing saturated fats and sodium helps decrease cardiovascular risk, control blood pressure, and prevent worsening heart disease. Question 38. A client admitted with myocardial infarction suddenly develops complete heart block with severe hypotension and syncope. Which intervention should the nurse anticipate? A. Immediate preparation for temporary pacing. B. Encouraging ambulation to improve perfusion. C. Administration of thrombolytics only. D. Restricting oxygen therapy. Answer. A. Immediate preparation for temporary pacing. Rationale. Complete heart block after MI can severely compromise cardiac output. Temporary pacing may be necessary to maintain adequate perfusion. Question 39. A nurse is assessing a client receiving thrombolytic therapy for myocardial infarction. Which laboratory value requires the most immediate reporting? A. Hemoglobin 14 grams per deciliter. B. Platelet count 210,000 cubic per millimeter cubed. C. Fibrinogen level significantly decreased from baseline. D. Potassium 4.2 MEq/liter. Answer. C. Fibrinogen level significantly decreased from baseline. Rationale. Marked reduction in fibrinogen during thrombolytic therapy increases the risk of severe bleeding complications and requires prompt evaluation. Question 40. A client recovering from myocardial infarction tells the nurse, "I'm afraid any activity will trigger another heart attack." Which nursing response is most therapeutic? A. Your fears are irrational because your condition is stable. B. You should avoid all exertion permanently. C. Cardiac rehabilitation helps clients safely regain strength and confidence after myocardial infarction. D. There is no way to prevent another heart attack from occurring. Answer. Cardiac rehabilitation helps clients safely regain strength and confidence after myocardial infarction. Rationale. Cardiac rehabilitation promotes gradual physical recovery, education, emotional support, and reduction of future cardiovascular risk. Question 41. A nurse is caring for a client 72 hours after a large myocardial infarction. The client suddenly develops severe hypotension, distended neck veins, muffled heart sounds, and rapid deterioration in consciousness. Which action should the nurse take first? A. Administer prescribed IV diuretics immediately. B. Suspect cardiac tamponade and notify the healthcare provider immediately. C. Place the client flat and encourage fluid intake. D. Prepare the client for routine discharge teaching. Answer. B. Suspect cardiac tamponade and notify the healthcare provider immediately. Rationale. Hypotension, jugular venous distension, and muffled heart sounds indicate cardiac tamponade, a life-threatening emergency that may result from myocardial rupture after infarction. Question 42. A client with acute myocardial infarction develops increasing ventricular ectopy despite antiarrhythmic therapy. The nurse reviews laboratory results showing potassium 3.1 milliequiliters per liter. A. Restrict potassium-rich foods. B. Administer prescribed potassium replacement. C. Encourage vigorous exercise. D. Reduce IV fluid administration. Answer. B. Administer prescribed potassium replacement. Rationale. Hypokalemia increases myocardial irritability and risk of life-threatening dysrhythmias following myocardial infarction. Question 43. A nurse is assessing a client after myocardial infarction who reports chest discomfort. Which finding most strongly suggests recurrent ischemia rather than post-procedural soreness? A. Chest discomfort, reproducible with palpation. B. Brief discomfort relieved by repositioning. C. New ST segment depression accompanied by diaphoresis. D. Mild incisional soreness after catheterization. Answer. C. New ST segment depression accompanied by diaphoresis. Rationale. ST segment changes with diaphoresis strongly suggest ongoing myocardial ischemia requiring urgent evaluation. Question 44. A client recovering from myocardial infarction suddenly becomes pale and unresponsive. Telemetry shows ventricular fibrillation. After the first shock is delivered, which action should the nurse perform next? A. Check for a pulse immediately for 30 seconds. B. Resume high-quality CPR immediately. C. Administer oral beta blockers. D. Delay compressions until rhythm stabilizes. Answer. B. Resume high-quality CPR immediately. Rationale. Following defibrillation, immediate CPR should resume to maintain circulation until rhythm and pulse are reassessed according to ACLS guidelines. Question 45. A nurse is caring for a client with myocardial infarction who develops acute kidney injury secondary to cardiogenic shock. Which assessment finding best indicates worsening renal perfusion? A. Urine output 12 milliliters per hour. B. Heart rate 88 minutes per hour. C. Oxygen saturation 96%. D. Respiratory rate 20 minutes. Answer. A. Urine output 12 milliliters per hour. Rationale. Severely decreased urine output reflects poor renal perfusion resulting from inadequate cardiac output in cardiogenic shock. Question 46. A client asks the nurse why rapid reperfusion treatment is critical during myocardial infarction. Which response by the nurse is most accurate? A. Reperfusion helps reduce the amount of heart muscle damage. B. Reperfusion permanently eliminates coronary artery disease. C. Reperfusion prevents all future dysrhythmias. D. Reperfusion removes cholesterol from the bloodstream. Answer. Reperfusion helps reduce the amount of heart muscle damage. Rationale. Rapid restoration of coronary blood flow limits myocardial necrosis, preserves cardiac function, and improves survival. Question 47. A nurse is monitoring a client after myocardial infarction who develops sudden dyspnea and a loud new systolic murmur. Pulmonary edema rapidly worsens. Which complication should the nurse suspect? A. Papillary muscle rupture. B. Stable angina. C. Pericarditis. D. Atrial fibrillation. Answer. A. Papillary muscle rupture. Rationale. Papillary muscle rupture causes acute mitral regurgitation, pulmonary edema, hypotension, and a loud systolic murmur after MI. Question 48. A client recovering from myocardial infarction asks why participation in cardiac rehabilitation is recommended. Which statement by the nurse is most appropriate? A. Cardiac rehabilitation focuses only on supervised exercise. B. The program helps improve cardiovascular health and reduce future cardiac risk. C. Rehabilitation eliminates the need for cardiac medications. D. Cardiac rehabilitation is only necessary for clients requiring surgery. Answer. B. The program helps improve cardiovascular health and reduce future cardiac risk. Rationale. Cardiac rehabilitation includes exercise, education, risk factor reduction, emotional support, and lifestyle modification to improve long-term outcomes. Question 49. A nurse is caring for a client with myocardial infarction who suddenly develops severe chest pain, hypotension, and unequal peripheral pulses. Which condition should the nurse suspect first? A. Pulmonary edema. B. Aortic dissection. C. Stable angina. D. Dressler syndrome. Answer. B. Aortic dissection. Rationale. Severe chest pain with pulse deficits and hypotension suggests aortic dissection, a medical emergency that may mimic myocardial infarction. Question 50. A client recovering from myocardial infarction states, "I'm worried this will happen again when I go home." Which nursing response is most appropriate? A. There is nothing you can do to lower your risk. B. Following your medications, diet, exercise plan, and follow-up care can significantly reduce future cardiac risk. C. Another heart attack is unavoidable after the first one. D. You should avoid discussing your fears so you can stay calm. Answer. B. Following your medications, diet, exercise plan, and follow-up care can significantly reduce future cardiac risk. Rationale. Education about risk reduction empowers the client and supports secondary prevention after myocardial infarction. That wraps up 50 NCLEX Myocardial Infarction Nursing Care, High Stakes. If these questions challenged your critical thinking, that's exactly the point, because on NCLEX, recognizing subtle signs, prioritizing fast interventions, and identifying life-threatening MI complications can make all the difference. Remember, time is muscle. Every second counts when managing myocardial infarction, whether it's recognizing STEMI, preventing cardiogenic shock, responding to fatal dysrhythmias, or catching deadly mechanical complications before it's too late. Keep practicing until these priorities become automatic. Recognize ischemia early. Prioritize ABCs and perfusion. Master MI medications and contraindications. Identify emergency complications fast. Think like the NCLEX and like a real nurse. If this video helped sharpen your cardiac nursing skills, don't forget to like, subscribe, and turn on notifications so you never miss the next high-yield NCLEX challenge here on MCQs Master 101. Drop your score in the comments. How many did you get right out of 50? See you in the next one, and keep pushing toward that NCLEX pass.